Good evening and thanks for joining us tonight. We are not where we need to be, but we are certainly heading there. COVID cases in North Carolina ticking down again. We have a graph that we can show you, the numbers since the pandemic started. You can see the spike, of course, that we dealt with back in the winter time, and then that second spike that we've been seeing here over the summer. But now it is coming back down. And doctors say it's because more people are getting vaccinated. More than 60% of people who are eligible to be vaccinated in North Carolina now fully vaccinated. And here's a breakdown by race. This is important. According to the state health department, only about 40% of the total black population is fully vaccinated. That still means many people have not gotten their shots, some by choice. And it's really putting a strain on doctors who are trying to talk to them about it. WBTV's Dedrick Russell talks with a black doctor about the talks he's having in tonight's community conversation.
When you look at those individuals that are currently hospitalized, whether it be at Novant Health or any other healthcare facility, the vast majority, over 90%, are unvaccinated individuals. If you look at the intensive care units and usage of ventilators, it's probably closer to 100% of those individuals who are on those ventilators are unvaccinated. So that's why we use the term, this is now a disease of the unvaccinated.
As a doctor and a proponent of the vaccine, do you get frustrated that that more people are believing misinformation than the correct information?
It's tough. I wouldn't say frustrated. I would say that it makes me more persistent. It makes me more persistent because we know the science, we know the facts. The data is overwhelming. I mean, it's not even subtle. It's not even splitting hairs. And so you just have to continue to present facts.
Do you know some doctors who are frustrated?
Of course, yes. It's not surprising that you have frustration across the healthcare spectrum. You have folks who've been battling for over a year, day in, day out, against this pandemic. Comforting families, comforting individuals. And, we're at a point right now, as you are well aware, where you have certain, not at Novant, but we've seen across the country where healthcare workers are being attacked for doing their job. And so, yes, there is some frustration out there, but I say the vast majority of the dedicated healthcare workers are still committed and all in because this is a calling. This is not a job. This is not a profession. It's a calling. I still have a few folks that I see periodically that will say, no way, I'm not getting vaccinated. And I'm still happy to see them, and we're still happy to care for them, and we'll still have the conversations.
Are they refusing because of misinformation, or are they refusing because of religious beliefs?
The resistance to COVID-19 is like any other resistance to recommendations for one's health. And you just have to meet people where they are. You have to educate them.
The people who are in the hospitals who have not been vaccinated, are you hearing stories saying that, oh, I wish I would have been vaccinated? Are you hearing those type of stories?
Some are. You get a wide spectrum. Some folks still don't believe they have COVID. Some folks will say that, yes, I have COVID, but I'm still not getting the vaccine. You hear the wide spectrum, and
so
it doesn't surprise us.
So you hear people who the doctor has diagnosed them with COVID, and they say that I don't have COVID?
I don't have COVID. They won't believe it. Some folks won't believe it. But once again, I go back to pre-COVID, right? I've had patients that I tell them that they're having a heart attack, and some of the risk factors include smoking and diabetes and lack of exercise and overeating and obesity, and they will be in denial too. Some would be in denial as well. So once again, that's why I always tell folks, COVID brought to the lay public what many of us in healthcare already recognized. What made COVID-19 different was it was political. Everyone knows that, right? It was a very politically charged medical problem that should not have been politicized. And so all the things that we know works really were not implemented in a timely fashion. There was even denial, right, that COVID existed. There was even reports that, oh, this is just as, not as bad as the flu.
What goes through a black doctor's mind when help is there and it's not received from the African American community?
Sure. So I look at that question in context, right? I look at it in the context of the health of African Americans 20, 30, 40, 50 years ago, access to healthcare 20, 30, 40, 50 years ago, right? We're nowhere near where we need to be in this day and age, but we've come a long way. And we've come a long way because we have many more of us caring for our communities. We have more cultural competency being taught across healthcare systems, so our white brothers and sisters or non-African American brothers and sisters are well aware of the potential cultural barriers when they go in an exam room. So I look at it from the standpoint of resiliency. We're a resilient people. My God, we're a resilient people. If folks can't see that, we've been through so much. This, in context of what we've been through, we're going to get through this and come out stronger.
Yeah, context important, right? Dedrick joins us here in studio. A blunt conversation, a really fascinating conversation. Tell me more, though, about this part where patients are in the hospital, they're diagnosed with COVID, still don't believe it. Does he know why that is?
Well, Dr. Jerome Williams has more than 10 years experience as a cardiologist, and he says that when he hears that from the patients, he said that he's not judgmental. He says, I can't judge them. He says that because everybody has their own experience, right?
Sure.
And he says that I cannot judge them, and I have to be able to figure out where they've been through and why they think the way they think. And he says that that's the point of connectivity is the key. And he says that if I start judging them, then I'm gonna have a hard time connecting with them. And with that connection, I can give them the right information, and then therefore they can trust me, and then we can make things better for them.
One thing I wonder about too is this can cause division in families, right? This vaccine and COVID itself. Did he have anything to say about that issue?
I asked about that. I asked about his family, right?
Yeah.
And so he said that fortunately no division in his family, but he says he knows black doctors where there is division, and the black doctors are telling their family members, hey, you need to get vaccinated, and those family members are saying, no, I'm not getting vaccinated. And he's saying to those black doctors that it hurts them because they know the truth, because North Carolina officials say that a person who is unvaccinated, right, is 18 more times to die than someone who is fully vaccinated. So with the doctor having that information, trying to help their family members, and they reject that, that can be frustrating.
Absolutely. He's been partnering with black churches, right, trying to get that word out about the vaccine, but yet we see the numbers that we saw, just 40% vaccinated. Where is he on that? Is he frustrated by it? What's he think we got to do here?
Well, he just says that he has to fight harder. He has to be more persistent. And I did ask him about that. And so he said that he has been out at the black churches. He's been at the grocery stores. He's been mobile pop-up, things like that. And he's saying that he believes that it is making a difference. The people he is reaching at those mobile clinics, that they are getting the shot. But he says that work still needs to be done, because he says that once COVID goes away, hopefully it does go away, that the doctors still have to be there, because there's still disparities, with heart disease, diabetes, strokes and things like that. So the doctors still have to be there talking with the black community, making sure that they stay healthy.
And with the cases and everything coming back down, sort of now's our chance again, hopefully, to nip this thing in the bud once and for all. Fingers crossed for that. Dedrick, great conversation. Thank you for being here with us tonight. We are bringing you these community conversations every Friday at 7:30. You can watch more of Dedrick's conversations right now on our streaming platforms. Just search for WBTV on Roku, Apple TV, or Amazon Fire.